Hello, everyone. This is Sabrina Young with Young's Daughters Funeral Home, and I'm so excited to be bringing Lorena Hampton with us, and she's with Bluebonnet Hospice and Health Services, excuse me. And so I'm really excited because likewise, she has been a proud wife for 37 years, and she has 3 grown sons, and she's also a grandmother of 4. She has her 2 Yorkies and 1 feral cat now that sleeps with them. And so she is just full of love and excitement. And so I'm very proud to be interviewing her and sharing more of exactly what hospice is. I know she has been in the healthcare facilities, and she has been around managing over 113 nursing respiratory therapy departments throughout Texas. I mean, she is just a mighty, mighty girl. And so I am just hats off to you. I really want the community to know what Bluebonnet is and what they stand for. Can you give us a little background about the company?
I sure can, and thank you for such a gracious welcome, Sabrina. It's good to be here with you. I joined Bluebonnet this year in July after years in healthcare services. Essentially, they are just a company who stands for what I stand for in caring for patients. They're not just numbers. It's not just about census. It's about integrity. It's about quality of care. It's about pain management, symptom control for patients who have been diagnosed with an end-of-life service. We also have a home health branch for those who may have had a recent surgery or illness, injury, and they are coming home and need rehab. But I specifically work in end-of-life and hospice care services, providing education to the community about that. So Bluebonnet started in 2003, literally with a folding chair and a fax machine. And since then,
all the big dreams start, sisters.
Exactly.
Start somewhere.
And I love that they are still managed, owned by the original owners, Mark and Holly Walsh, who started Bluebonnet in 2003. Since then, just this past year, we've opened satellites in Round Rock, Bryan College Station, and San Antonio. So we're able to extend our services throughout Central Texas. And they have been voted actually Best of Waco in home health services for 14 annual consecutive years, and Best of Waco in hospice for 7 annual consecutive years. And that's that just really says a lot about the company just as a whole, because not only do they provide for the patients and their families, but also for the communities in which we're serving. So I'm just so honored to be a part of the Bluebonnet Health Services team.
Wonderful. So I'm excited that you're sharing this much information, because a lot of people don't realize what is hospice and what is home health, right? And so tell us a little about can you tell us about the 2 parts of that?
Well, sure. Home health is more for patients who, again, they just need some rehab. Maybe they've been in the hospital for an extended length. They went to a rehab or a skilled nursing facility, but then they met all of their goals there. So now they're ready to go home. Our care team would then be able to take care of them in home, take that baton from the rehab or the skilled nursing and continue working with them, even down to just certain things like checking to make sure, are there area rugs that may slip? Do they have electrical cords that may be a trip hazard? Just those little things that people don't typically think about when they're returning home from an injury or illness. Our team can manage that. And then also, of course, with nursing and therapy and things of that nature. Whereas with hospice, that's more for those patients. I would say that the biggest myth that I have, or the biggest misconception that I come across with it, is that the patient is bedbound and actively dying. And that's not what hospice provides. I mean, certainly if that's the case, it's just unfortunate that that is a late referral. We'll still be able to pain management, symptom control, family support, but for the full benefit of what hospice can offer, Typically, it's going to be with a diagnosis of expected diagnosis without any curative interventions. The patient would probably have a life expectancy of 6 months. So with that, then our team would come in and manage their care for them. I'm not sure if you want me to go ahead and go in and discuss where those services can be provided and what.
Because a lot of people are fearful. They say, do I have to leave my home to be on hospice? Am I only bound to my home? Am I now on house arrest because I have hospice? Can you talk about that?
Absolutely. And thank you for asking, because certainly that is a huge thing that I get all the time. A lot of people believe that hospice is a place. They have to go to a hospice, where hospice is actually a service. And that service provides the pain management and symptom control through an entire interdisciplinary team. And we'll discuss that here in a little bit as well as we're delving into that. So no, a hospice can be wherever they call home. So whether it be their private home, if they're in an assisted living or a nursing home, if they're with family. We've even had patients who are homeless that we are still able to provide care to. Wherever they lay their head, we're going to be there for them. So that's the biggest misconception. And no, they don't have to be actively dying to qualify for hospice. For example, if somebody maybe has a diagnosis of stage 4 cancer, they had already fought cancer in the past, and this is just from a recent patient that I was visiting with, didn't want to go through with chemo and radiation anymore. They're done. It's metastasized, and they just want to make sure that, first of all, that they're not in pain, and that the pain medications sometimes have symptoms that go along with those, that those symptoms are managed. And then not only for their own personal and psychosocial and mental health, but for their friends and loved ones around them as well. So there's so many different aspects that need to be addressed with each patient that our team will identify and work with that patient and their family with.
I love that you call it a service, right? I love that you have said that it's not so much a place, it's not so much something that you have to do, but I love that you call it a service. So tell me about when you are getting your services, will someone be with them all the time? What type of staff encompasses your service? What to expect? What kind of people do they meet for this service?
Well, initially they'll meet probably me as I'm coming in and visiting with them if they need additional information. Otherwise, we have an amazing intake nurse at our office who has been with the company for 14 years, and she just gets it done. She's fantastic. And then once a patient decides that, yes, this is what they want to do, and the family is on board and everybody is in agreement, then we'll send out an admissions nurse, and that person will then go over all of the criteria with them, do a head-to-toe assessment with the patient, and spend that time. What are their biggest concerns? What are their fears? Because what's everybody's number one fear is the fear of the unknown. So we try to take that away from them so that they completely know exactly what the service is going to provide. So having said that, kind of in a nutshell answer, Sabrina, would be that in addition to the patient's primary care physician, we also have a medical director. The patient would also have a registered nurse, an LVN, a certified nursing assistant who, I'll come back through, social worker, chaplain, and volunteers. So what each of those would entail is the physicians would, our physician would reach out to that primary care physician, ensure that any medications that we would want to prescribe are not going to counteract something that the patient is maybe already on, do what we call a pharmaceutical reconciliation. And then the nurse is who's going to come visit that patient in their home, ensure that the medications are doing what they should be doing, educating any family or caretakers that are there in the home with them on how to provide medication support, pain management, things of that nature. How to
That's really important.
It really
think that's
is.
super important to educate the families. You know, we have grief classes here, and so many times do we hear the families, you know, they're in grief because now they find themselves as a caregiver. And so educating them how to now be a caregiver when they probably never had to take care of an elder adult. And so I think that's an amazing service that you offer. But what if maybe they're clinically ready, right? But maybe they're just not sure. Do you have any additional outreach programs or services for that?
We do, actually. And one of the things that I'm just so grateful for Bluebonnet in providing is called supportive care. It's not really a service that I've seen anybody else provide. It's a zero-cost service. We don't bill the patient, Medicare, insurance. There's no change of money involved. But one of our social workers who has run this program, I want to say 12 years now, I believe. So, who has some longevity there with Bluebonnet. But essentially, she'll either come into the home and visit with the patient or just do a phone call with them and just ensure, do they have the psychosocial services in place? Do they need assistance securing any medications or equipment or supplies or things of that nature to help them while they are still, whether they're seeking curative options or maintaining, maybe they're on dialysis and they're just maintaining their health, so they're not quite either physically or mentally ready for those end-of-life services yet. But she can just work with them as they, if they're continuing to decline, so that she can make sure that that patient is receiving the right services at the right time.
Wow. And that's amazing. Actually, one, to hear somebody stays at a job for, you know, that longevity of time, it's very rare these days, but that speaks volumes for your company, definitely. But you also mentioned that you have free services. So when it comes to cost, how does one pay for the paid side of your services? What does that look like?
On hospice care, they're all covered by Medicare. So Medicare, Medicaid, private insurances will virtually cover the entire cost of all of our services, equipment, medications, supplies, anything that's related to that life-limiting illness, to that hospice diagnosis. So virtually any costs to the patient or to the family are non-existent. Everything would be covered by their benefit. And it's an underutilized benefit, and probably the one that unless a person dies suddenly and unexpectedly, if they are able to live out the entire course of their lifetime, everybody should have hospice for that last 6 months or so.
Wonderful. So I do have to ask the myth. You know, I hear it come across my desk all the time. So please be the myth buster on this one. Does hospice care, the fear is that as soon as you're on hospice, they give you so much drugs or they give you the morphine and it's going to just ease you into that transition into death. Tell us a little bit about that. Like, how is that a fear that most people go through? Is that a myth? Is that real? Tell us about that.
It is absolutely a myth, and I'm happy to bust that myth for you because, like you, I get that question all the time as well. I literally had a patient several years ago now who signed her paperwork with me and then wanted to know how long would it be before the nurse got there. And I told her she was on her way, maybe about another 45 minutes, and the patient started hyperventilating because that wasn't enough time for her. She needed to say her goodbyes. Look, I'm going to get emotional about this because it was just so heartbreaking. She thought the nurse was on her way over to basically euthanize her, to give her a shot. She didn't realize, and I felt like I dropped the ball, you know, because I had had this conversation with her. It never occurred to me that she didn't have the full grasp on the fact that we were just going to be there with her throughout the course. So I had to backpedal a little bit, but it was a learning lesson for me as well. So moving forward, I ensure that my families and the patients that I'm visiting with understand hospice is not here to shorten or extend the life expectancy. I have seen patients who actually, because their pain is under control, they're no longer begging God to die every day. And I've also seen those whose pain is so much under control, they're no longer fighting it and can pass peacefully. So no, to break the myth, hospice does not hasten or lengthen the life expectancy. We simply, with the doctor, the social worker, the nursing, the certified nursing assistant, provide those services that are just going to maintain pain management and any symptom control.
Wow. Well, I'm
Thank
really
you for letting me clarify that.
Yeah, because that is such a fear, and it's funny because we say humans will say things over time and it's very repetitive, and everybody believes something that they heard, and then this is what my experience was. And it's like, we get the same thing. Do bodies sit up at the funeral home, right? It's just something people say, and I'm like, why do we say that? And why do we say that they're going to get euthanized in the fast time? So I'm glad you're able to answer that question, because it is a huge fear. And I think that if people can get over that fear, I think they will find more joy with their hospices. And I'm so honored that you are able to come out onto our platform here and talk about Bluebonnet Health Services. I do want to let the community know how to get in touch with you. I know your office is located at 307 Londonderry Drive, and it's out of Waco. They're zip 76712. And then you provided your cell phone number, so I'm going to share that. It's 254-624-6351 if you need to get in touch with Mrs. Hampton. But the office line, if you need the other services that she might not be able to answer right there, and you want to call the office, maybe there's going to be 254-751-1790. And sister, I want to thank you so much for giving us the incitement and being so lively about it, because many people come here and they say, Sabrina, that's it, I just got diagnosed. And I always have to say, hold on a second, you're not ready at this moment to pass away. We got to backpedal just the same. I need to get you some hospice and home health. And so I'm really glad that we get to share this end of life journey with the families, because knowing that you have a good transition into a funeral home is very vital. So that way that passing is easy, the paperwork, all the end of life documents are there. And so that's one thing that we do provide is free wills, free advance directives, power of attorneys, authorizations from notaries. So just if any families needed notary services or they want to make their last wishes known, then we go bedside, much like your volunteers. I'm sure we would just come out and do those free additional services. So I'm glad you're allowing us to be an extension of Bluebonnet Hospice. We're really excited.
Well, I appreciate your time and for allowing me the opportunity to share our services and to partner with you and help you answer some of these questions when you're faced with them as well. I appreciate it.
Absolutely. With YouTube followers and Facebook and every other platform that we have, you can find all of our information down in the comments or attached to the video information. But if you haven't seen it, this video will also be posted on our website at youngsdaughters.com. Thank you so much, everyone. We sincerely appreciate you.